special non-blood collection procedures. So there are samples that are collected that are, not blood, and one of them is a urine sample. So why do we collect urine? Urine is created by the kidneys as they filter the blood. Urine can contain excess salts and waste products and small amounts of a whole bunch of other different types of molecules that naturally circulate in the bloodstream. So for this reason, the urine provides a snapshot of how the body is working. So for those samples, they should be delivered to the lab within 1 hour of collection, and that helps to prevent the breakdown of unstable compounds. When this is not possible, so if we aren't able to get it there within an hour, it needs to be refrigerated and preserved depending on what we're testing for. There are different types of urine specimens as well. So a random specimen can be collected at any time. It is used to screen for obvious metabolic abnormalities by measuring protein, glucose, if there's blood in the urine, and any other significant constituents of urine. First morning specimen is exactly what it says. It's the first urine that somebody will void that day. It's also called an 8-hour specimen. It is collected immediately after the patient awakens. This is a more concentrated urine specimen since it's probably sat in the bladder for, about 8 hours as the person has slept. And this helps to ensure that there is the detection of chemicals or pathogens that we may not find in a random sample throughout the day, because that random sample, after you've drank and eaten and gone to the bathroom multiple times, it'll be more dilute than it would be for a morning. So there is one disadvantage of a random specimen, and like I mentioned, it may be too dilute for certain testing of analytes. So a urine pregnancy test is one of those examples. So if we're doing a urine pregnancy test, a lot of times we like to have the first morning urine for that, as it will be the most concentrated of the HCG, which is what we're looking for pregnancy. There's also a timed specimen. And this is a series of samples that are collected usually over 24 hours, and then it's combined into one single large collection container. That is used to measure the amounts of protein, creatinine, and hormones. This typical procedure is to have the patient void and discard the first morning sample, and then they would collect and combine all urine for the next 24 hours, ending at the same time that the patient started the test the previous day. So usually we will give patients a big jug to bring home so they can collect their urine in it. And it does usually need to be refrigerated as well. So depending on your facility, they would have handouts for patients and instructions for them and you to go over to make sure that it is collected appropriately. There is collection procedures for urine specimens as well. So when they are properly collected, the specimen is basically sterile, as urine should be. So if the patient has like a urinary tract infection, like a UTI, then it wouldn't be sterile. There'd be bacteria and white blood cells and stuff found in there. So that's why this is important, to make sure they follow the collection procedures, because the urine itself should be sterile, but when it comes out and gets contact of the outer urethra and stuff, that is when it can become contaminated and may actually skew results. So the most common procedure for collecting urine is known as a midstream clean catch, and it is collected after the patient has passed several milliliters of urine. And this helps to allow microorganisms that are in their urethra or on the outside of it to be flushed out and not collected in the sample. So as you can see in the picture, there's different collection procedures for males and females. They just need to, ensure that they are doing this appropriately to make sure that area is clean for when they are collecting their urine sample. For the midstream clean catch, they would clean the genitalia. So for women, they would use a sterile soap or like a wipe to clean the area surrounding their urethra. And then for men, they would also have a wipe or a towelette that has benzocaine and alcohol. And then for uncircumcised men, they would actually retract the foreskin for cleaning. Collecting the sample, the specific procedures for sample collection may differ between institutions, but generally after they do the cleaning, they're going to want them to go a little bit in the toilet, and then as the name suggests, collect it midstream. So they'll let a little bit out, and then they're going to try to collect the rest of it in a cup. And then they are going to finish the collection. They're going to cap the container, make sure that it is labeled with that patient name, date of birth, time of collection, and date of collection as well. And then we are going to refrigerate or add preservatives if needed. For pediatric collection, as you can imagine, they are not potty trained most of the time yet, so it's kind of hard to get urine from them. So for pediatric specimens, for routine urinalysis, it can be collected using a clear, soft bag that actually has adhesive on it that fits over the genitalia of the child. So once that bag is attached, a diaper is put on over the bag, and then when they do go, it'll go into that bag, and then we can bring that bag in for testing once they are done. This is considered not a sterile collection, so we wouldn't be able to probably check for UTIs or anything like that. There's also catheter collections. It can be used if the patient is unable to collect a sample by themselves. Phlebotomists do not insert catheters, but depending on where you work, you may be able to assist in processing the sample after the collection. So a catheterized urine sample is collected by a physician, nurse, or a medical assistant. So a catheter, which is a narrow plastic tube, is actually inserted through the urethra into the bladder. And this technique may be used for a culture and sensitivity test when a urinary tract infection is suspected, and then can be obtaining a normal clean catch. If a clean catch specimen is not possible, then a catheter collection can be used. Suprapubic aspiration. So this is a sample that is collected by a physician. So we, as a phlebotomist, would not be collecting these samples, but it's important to know what it is. So essentially what it is there is a needle that is inserted through the abdominal wall into the bladder for the collection of the sample. The specimen is used for bacterial culture of anaerobes, bacteria that don't grow in the presence of oxygen, and for cytologic, which are cell examinations in cases of suspected bladder cancer. Urine samples for drug testing. So urinalysis can reveal the presence of a whole bunch of different types of drugs and certain metabolites in the bloodstream. Drug testing has become pretty common in outpatient settings that are driven by the concern for a drug-free workplace. So a lot of places, especially if you work in like an outpatient doctor's office or something, you may be collecting drug testing on patients. So just know that you might have a part in this. Collection and handling procedures must follow that chain of custody that we talked about earlier, because the sample may be used in a legal proceeding or in decision making regarding employment or athletic participation. All right, another type of sample that we may get is a fecal or a stool or poop specimen. So the two most common reasons for ordering a fecal sample are to look for intestinal infections and to screen for colorectal cancer. Microscopic examination of feces can reveal the presence of intestinal ova and parasites, also known as an O and P, from organisms such as Giardia and tapeworms. So those parasites in the body, we can actually check in the stool to see if they're there. Feces can be cultured to look for diarrhea-causing bacterial diseases like cholera or salmonella. We can also do tests for checking for the cancer of the colon, which can cause bleeding. And this blood is called occult blood, which actually means hidden blood. And we can detect this chemically by doing tests on it. Feces can also be chemically analyzed to reveal digestive abnormalities, such as if they have excess fat or undigested meat fibers, which may indicate a gallbladder disorder or other digestion abnormalities. There are different types of fecal specimens. So there's a random specimen, which is used for most things that we would need stool for. So that would be bacterial cultures, O and P, looking for fats and fibers. There is that occult blood, like I mentioned earlier. These specimens are collected after 3 days of a meat-free diet. And that is because if they have meat during that time frame, it can actually give us a false positive result. A 72-hour stool specimen is used to look for the quantitative fecal fat determination. We don't do this very often, but it can be ordered when a random specimen is positive for excess fat. That occult blood specimen I was talking about, like I mentioned, it needs 3 days of meat-free diet. Otherwise, we could have a false positive. Other things to avoid for patients would be eating broccoli and turnips, raw fruits and vegetables, horseradish, vitamin C supplements, and certain pain relievers like Motrin and aspirin. Several types of these special test cards are available, which may be prepared by the patient at home and sent in. So that picture down below is actually like one of those cards would actually look like. And depending on where you work, you may be able to actually run this test or set it up like shown in the picture. Collection procedure for fecal specimens. So patients should be given the appropriate collection container and then instructed to defecate into it, not the toilet, which would potentially contaminate the sample with cleaning compounds and other things that are in the toilet. Patients should also be instructed to avoid contamination of specimens with urine if possible, and specimens should be kept at room temperature until delivery to the laboratory. Another type of sample that we may get in the laboratory is a semen specimen. So semen specimens can be used to determine if there are viable sperm that are present in the semen, either for fertility testing or to assess the success of a vasectomy or not. Semen can also be collected as a forensic specimen from a rape victim, but this is collected with a special kit by trained personnel and handled with a chain of custody. So once again, depending on your facility and what you're doing, you may be a part of that process or you may not. Collection procedure for semen specimens. So the patient should be instructed to avoid ejaculation for 3 days before the collection. The sample should be ejaculated into a sterile plastic container. The time of the collection should be recorded because sperm die pretty quickly, and viability analysis is based on the time elapsed since the collection. If it's for fertility testing, the volume of semen is also important, so the patient should report whether the sample collected is complete or partial. Another sample type we may get in the lab is a throat specimen, and depending on where you work, you may actually collect these as well. So a throat culture sample or a throat swab is used to diagnose throat infections such as strep. So the sample is used to determine whether the infection is going to be caused by group A streptococcus bacteria. And if that's the case, they can actually give antibiotics to help the patient get rid of it. Diagnosis is performed with either a standard bacterial culture or a rapid strep test. And once again, depending on where you're working, you may actually run the rapid strep test to confirm diagnosis of strep. Another type of specimen we can get is a nasopharyngeal specimen or an NP swab. So the NP culture is used to diagnose whooping cough, croup, pneumonia, respiratory syncytial virus or RSV, and other upper respiratory tract infections. When COVID first started to come about in 2020, the NP swab was the only option we had for a specimen type. But since then, luckily, it's gone to just the nasal, so it doesn't have to go in as far. The collection procedure for the nasopharyngeal specimen is the specimen is collected using a cotton or Dacron tipped sterile wire swab. The swab is passed carefully through the nostril to reach the back of the nasal pharynx, and then it is rotated gently to collect mucus sample and then removed carefully. This is not a pleasant procedure for those of you that have had it done. I'm sure you are aware and probably don't want to have it done again, but just know that it's not comfortable for patients. But we need to make sure we do get the appropriate specimen, so make sure you get back far enough and rotate it. Because if you don't do that, you're not getting the right specimen, and then at that point, why are we even testing, right? Okay, so then after you get that swab removed, you're going to place it into transport media or growth media, depending on which test is going to be performed. All right, and then another specimen we could get would be a sweat electrolyte chloride specimen. These don't occur very often, and it's really going to be dependent on where you work as well. So the sweat electrolytes are the salts, including chloride, that is present in everyone's normal sweat. The sweat electrolyte chloride test is performed when they're looking for cystic fibrosis diagnosis. So a person that actually has cystic fibrosis is going to have elevated levels of chloride and sodium in their sweat. So the collection procedure for the sweat electrolyte chloride specimen is the sweat electrolyte chloride specimens are subjected to the ionotrophoretic pilocarpine test, which requires special training. Like I mentioned, more than likely it would not be a phlebotomist collecting these. But just kind of as an FYI, just so you know. And then the sweating is induced by applying a weak electrical current and then the drug pilocarpine to the test area. The sweat is then collected on a piece of sterile filter paper, which is then weighed and analyzed for the amount of chloride. Another sample we can get is a cerebrospinal fluid, or CSF fluid. So CSF circulates in the brain and spinal cord, where it actually provides nourishment and removes waste from the central nervous system. It is most commonly collected by a lumbar puncture, or you may know it as a spinal tap, in which a needle is inserted between the vertebrae of the base of the spine. 3 to 4 tubes are collected in sterile plastic containers and numbered in the order of collection. So the CSF collection is done only by a physician. So the phlebotomist may be asked to process and deliver samples after collection, but we would never be collecting these types of samples. The CSF is used most commonly to diagnose meningitis or other central nervous system infections. The laboratory department gets which tube is determined by the policy of where you work. So like I mentioned earlier, they are labeled 1 through 4. So that is very important. And then it's really going to depend on your policy and procedure of which department within the lab is going to get number 1 or going to get number 2. The spinal fluid specimens are always delivered to the laboratory immediately and are analyzed as a stat collection. Generally, Tube 1 is reserved for non-routine studies like cytology. Tube 2 is used for immunology and chemistry testing like glucose and protein. Tube 3 is usually delivered to micro for gram stain and culture. And if there is a 4th tube, it will go to hematology. Hematology testing is important to account for any peripheral blood contamination of the sample during the lumbar puncture, which would otherwise give misleading results. So we don't want to give the hematology department who's looking for blood in the spinal fluid number 1, because that was the one that happened right after the puncture. It could have a little bit of residual blood in there and could actually give false results. So that's why the numbers are extremely important. Common body fluid collection. So we can also get other fluid from the body, such as synovial fluid, which is from the joint spaces, and that is usually for diagnosis of joint disorders and pain reduction. Peritoneal fluid, which is part of the abdominal cavity, and this is a lot of times a diagnosis for ascites. Pleural fluid is from the pleural cavity, which is around the lungs, and it will help for diagnosis of pleural pneumonia. And then we have pericardial fluid, which is actually the fluid that surrounds the heart, and this can help in diagnosis of pericarditis. Amniotic fluid specimens. So amniotic fluid is the fluid within the amniotic sac, which is developed within the uterus that actually bathes and cushions the baby when it's forming. So it is formed by the metabolism of fetal cells, by the transfer of water across the placental membrane, and in the 3rd trimester by fetal urine. So amniotic fluid is collected by a physician in a procedure known as an amniocentesis. This fluid may be tested for proteins associated with other abnormalities like spina bifida. And the amniotic fluid is removed by a needle that is inserted through the mother's abdominal wall into the amniotic sac. The fluid is transferred into a sterile container, protected from light, and is immediately transported to the lab for analysis. Again, phlebotomists would never be collecting this sample, but they may be in charge of bringing it back to the lab or transporting and processing it for testing. All right, and then we could also get breath specimens. So analysis of breath is used to diagnose certain things such as small intestinal bacterial overgrowth, malabsorption syndromes, and Helicobacter pylori infections. So lots of those diseases actually cause changes in the composition of your breath. So H. pylori or Helicobacter pylori is a bacterium that causes infections and ulcers in the stomach and duodenum. The patient is given a urea and capsule to ingest. The patient must prepare for the test by observing the following. So they would have no antibiotics for 4 weeks. None of the following medications for 2 weeks before the test, such as Prilosec, Prevacid, or like Pepto-Bismol. Nothing to drink, including water, for 4 hours before the test either, as they can all skew results. A collection procedure, a patient is going to be given substance to ingest, as mentioned. Its metabolic byproducts are measured in breath. The rear breath test is used to diagnose H. pylori infections. Saliva specimens can be sent to the lab as well. They can be used to measure certain hormones or alcohol and other drugs. The collection procedure is saliva specimens for hormone testing are typically frozen and then packaged in ice before it's sent off to the lab. And then day, night before saliva collection, the patient should avoid using facial lotions and creams. For oral fluid mouth swab for a drug test, the patient should avoid mouthwash for 20 minutes before collection. And then gastric fluid. So gastric fluid is also known as stomach fluid, is used to assess abnormal acid secretion under basal and stimulated conditions. It can also be used for other pathologic changes that would indicate disease, like the presence of red blood cells, yeast, or pus from a wound. The collection procedure for gastric fluid is the patient must fast 10 to 12 hours before a procedure, and then the nasopharyngeal tube will pass through the nose and throat into the stomach. And the stomach is emptied of its contents and will be tested.